Every minute, 2 or 3 patients arrive at Sabain Hospital in Sana'a. Children, many already malnourished, also suffering from cholera. The outbreak began last year, but a second wave of the waterborne disease is spreading fast. So far, about 180,000 cases recorded over the past 2 months. That's more than the total number of cholera cases recorded worldwide in 2015. It's the vulnerable that are afflicted the most. At least half of the patients are children, frail and too weak to even care for their suffering.
We're receiving many patients from all over the country, and some are in bad condition. We're facing many obstacles. We lack many medical equipment, rehydration solutions, and medicine. There's a lot of pressure on us. We need more aid to reach clinics in rural areas and towns so we can take a little of the pressure away from us.
Cholera can be easily treated by replacing lost fluids right away. But after 2 years of war and airstrikes, much of the health system has collapsed. Many clinics and hospitals are not operating, and access to clean water is rare in many parts of the country. So for a large number of patients, reaching the closest medical facility can be life-threatening. Many of those at Sabain Hospital had to travel for hours to reach here, and too often it's too late. More than 1,200 people have died, and doctors warn these are just the early stages of the outbreak. Others are barely alive. The UN is blaming all the warring sides and their international backers for what it calls a man-made humanitarian catastrophe.
This is because of conflict. It's man-made, it's very severe, the numbers are absolutely staggering, it's getting worse, and the cholera element, in addition to all the lack of food, the lack of medical supplies for people, is of course primarily one has to put that at the door of all the parties to the conflict.
It's expected that the number of cholera cases will reach 300,000 in the coming weeks, and the number of dead will also increase. Sabain Hospital, one of the few still functioning in the country, is overwhelmed. New patients are being put in tents to be treated. Oxfam has called for, quote, a cholera ceasefire, but the war shows no sign of letting up. And there's no sign of an end to the suffering either. Hoda, Abdul, Hamid, Al Jazeera.